Thank you. We're a very small and select group. That's absolutely fine. Thank you very much for coming. I think there are a number of other events going on today. We have had a number of apologies. So there's a Heads of Academy Away Day, and there are also some seminars in health and population sciences. So there are some people that would like to be here but aren't able to be here, but I'm sure we can have a good discussion. I don't know whether would it be a pain to the people at the back? Is there any chance you might move a little bit forward? It's just that I feel a little bit exposed because there's this great big yawning gap. So if you wouldn't mind, just if you're really brave, you could come onto the front row. Yeah. Oh, okay, almost. That's better. Okay, so as John said, I've been involved with interprofessional education for a number of years now, and about a year ago, the college set up, or the College Learning and Teaching Committee set up a steering group to look at developing a coordinated approach to how we develop IPE across the college. And that group has been working quite hard, and we've actually got a draft strategy at the moment. Now, I've got some copies that you can take away with you if you wish to do so. But you'll see when you see the strategy that it's very much an outline strategy. It's a very much a top level. We've got some underlying principles. We've got some overarching sort of strategies that we think will fit with our particular situation in the college. And we've got a possible model for how we take the strategy forward. And blended learning, or e-learning, is going to be a big contributor to that strategy. So essentially, what we're looking to develop is a blended learning approach. And what I'm really keen on, we're going to be working on that strategy over the next few months. And I'm very keen on your ideas and thoughts about how we take things forward, particularly from the blended learning point of view. So what I'd like to spend the next few minutes doing is perhaps setting the scene for a discussion. Perhaps for those of you who aren't so familiar with IPE, I can say a little bit about that and why it's important. Say a little bit about maybe why people are so interested in blended learning for IPE. Then maybe a little bit about the college strategy, explain the sort of top line model, but then really get into discussion and think about your ideas about how we might take this forward and what issues we would need to consider. Does that sound reasonable? Yeah. Okay. So perhaps if we say sort of half and half, but please, as we go through so I go through the sort of scene setting, if there's anything that you'd like to comment on or ask about, please don't feel that you have to wait till the end, because it's very much a discussion. Some of you will be very familiar with this definition. This is the Centre for the Advancement of Interprofessional Education, or CAPE, which is the leading UK organisation for the advancement of interprofessional education. And in 2002, CAPE put together a definition of what IPE is, which has been accepted, I would say, probably worldwide. It's certainly international now. And the CAPE definition says that interprofessional education occurs when two or more professions meet together to learn with, from and about each other to improve collaboration and the quality of care. So what we're looking at is getting medics, dentists, pharmacists, nurses, physios, different groups of health professions together to actually have contact with each other, so that they can learn about each other's roles, about how teams work and so on. And really, IPE is a means to an end. It's a means to helping to improve teamwork and collaboration. And you might ask, well, why is it important? Sorry, I should say, before we say why is it important, but the professional regulatory bodies have recognised the importance of IPE for developing students' teamwork skills. And this is an example from Tomorrow's Doctors. I could have taken a quotation from the other documents about how you train professionals, but this is one from Tomorrow's Doctors, which just highlights the requirements on education providers to offer students the opportunity to take part in IPE. But you might say, well, why is it important? Why should we look at that? And I think if you're going to think about that more widely, you need to look about how patient care is changing. It's a bit of a truism, really, isn't it? That it's a bit of a truism that patient care is changing, but it is. And I think this quotation, this is our former Dean of Medicine, Professor Ian Booth, who some of you will be familiar with. You'll know he retired a year or two ago, and this is a conversation which really stuck in my mind, where Professor Booth was saying, well, when he qualified, there were some medicines, but they weren't that effective, and they weren't. If you made an error or if there was some problem, it wasn't necessarily a catastrophe. And now he says we've got many more medicines, and they're also much more powerful, and the risk to patient safety is that much greater. So there's an issue about patient care, the way patient care is organised. There's an issue about medicines, and patient safety has come much more to the fore in recent years, and it's increasingly recognised the contribution that teamwork can make to patient safety, and by implication IPE, which helps to develop teamwork, is increasingly recognised. I've got a little clip here which is only quite short, but I think it's quite telling. And this is an illustration of the importance of teamwork for patient safety. And this is one. It's only short. A hapless footballer. It's wonderful, isn't it? Yeah. I hope he was okay. It looks quite amusing. But of course, actually, it's much more serious than that clip would suggest, and it's quite. I'm not quite sure what the word is, but it's quite pertinent. Sue, my colleague, and I, before we came in here, we were actually listening. There's at the moment, David Cameron is speaking about the Francis report on the Mid Staffordshire inquiry, which is obviously just been published today. But there are other instances of situations where things have gone wrong in a hospital setting or a care setting, and teamwork has been implicated in the problems. So it is a very serious issue. So as I say, it's increasingly recognised that interprofessional education can help to contribute to developing students' ability to work in teams, their understanding of the roles of other professions, and their capacity to work collaboratively. And there's a lot of interest in interprofessional education, and there's a lot of interprofessional education going on, both within the UK and nationally. And if you look at the examples, there are hundreds of them, and they range from classroom activities through to interprofessional ward rounds and practice-based activities, and then somewhere in the middle you've got some various forms of simulation and training wards and so on. But actually putting interprofessional education into practice it's quite challenging. There's a lot to consider. And in putting interprofessional education programmes into place, there's been a tremendous interest in using e-learning and the contribution that e-learning can make. And these are just 3 examples of fairly recent reports of initiatives to use e-learning for interprofessional education. And you might say, well, why? What is the attraction for e-learning for interprofessional education? Well, they're various, and I've listed some of the ones here. Some of them are logistical, so purely getting 5 or 6 professions in a room at the same time to undertake an activity, or even 2 or 3 professions, can be quite challenging. Timetabling, rooms, other commitments can all cause logistical problems. So if you've got the advantages of e-learning, then some of those logistical barriers can be overcome, and that's one of the advantages. But there are also others. So the opportunity to come into contact with professions that are perhaps not represented at your institution. So if you've got, here we've got a range of professions, but we haven't got radiographers, for example. We haven't got operating department practitioners. We haven't got midwives. And having a connection involving e-learning can bring those groups together. And it can be a good space as well for students to reflect, perhaps even a safe space in which to reflect on various issues. And I'll perhaps say a little bit more about that in a few minutes. So there are lots of advantages of e-learning, and looking at IPE with a contribution from e-learning. And in fact, we have got some blended learning here in the college already. I've got a couple of examples here. These are ones that you might be familiar with. These are the case studies in patient pathways, which have been around for a few years now, and which the educational technology team were instrumental in putting together. These are interactive e-learning packages of the patient pathway, and I think we've got 10 or 11 common conditions now, each having a series of video clips showing a virtual patient going through the pathway, and then various interactive activities. And these are just some screenshots from a couple of the pathways, and you can see the interactive activities. I was always really keen on the goniometer. That was one of Dalby's triumphs. The goniometer was a triumph. And those, as well as using those pathways for independent learning, which the students can do, and they have been used extensively by a range of professions over the last few years. Colleagues in teaching trusts such as Russell's Hall have used the pathways to actually put together blended learning clinical attachments. So these are relatively short pathway-based attachments where students use the e-learning materials but also spend some time on the wards. So it's a good blended learning approach. And that's been, those pathways have been successful, I think. We're in the process of updating those pathways and the website that hosts them, and extending the resources available to students and adding some resources for tutors in a portal that's called Teamwork Matters. And we hope that will be available to students and tutors within the next couple of months. And then a very powerful development, Nikos Espathou in Department of Nursing and colleagues from the Interactive Studies Unit have been using or working with role players who've taken the parts of patients and involved in end-of-life care situations. And they've produced some very powerful video clips which can be used in a range of settings to encourage students and mixed groups of students to explore those issues. At the moment, these are a standalone video, but there is potential to develop those into a full e-learning resource.
Where do you find those? Sunshine?
Sorry?
On your website. Where are they from?
They are, they're as a result of a Strategic Health Authority funded project, and Nikos has had 500 DVDs produced. So if you would like a copy, I'm sure there are ones available.
Mental Life Workshop, RPE.
Absolutely.
So it might be quite useful.
Yeah, I think they might well be a very good resource for you. Yeah. We can sort that out afterwards. Yeah. So we've got the strategy, and as I mentioned before, the strategy includes underlying principles. It includes some overarching strategies that will suit our situation, and it also identifies some learning outcomes that we're particularly focusing on. So you can see that teamwork is up there, but we're also interested in particularly learning and reflection and patient-centred care and so on. And I think the blended learning and the resources that we've already got, and hopefully the ones that we will develop over the next few months, will fit very well with those learning outcomes. So if we look, if you'd like to look at your strategy, I think it's actually page 5. The steering group has put together what we're calling a passport model for developing a college approach to IPE. And you'll see this is a sort of simplified version. Sorry. This is a simplified version of the model that you've got on your page. And perhaps I could talk you through it a little bit. On the left-hand side, you see it says course 5-year left, 3-year right. And this is just a column that shows that, in fact, that this model will have to cope with courses of different lengths. So we have a 5-year medical course, soon we'll have a 4-year pharmacy course, we have 3-year courses as well. But the idea is that we divide the courses into, if you like, beginning, middle and end, and that we can cope with different lengths of course in that way. But the idea of the passport model is that as students progress through the years of their course, they will have a common strand of theory, which is all about teamwork, how teams work, roles and responsibilities of other professions, that will gradually build up as they progress through their course. And then that theory will be supplemented by I've called it a menu, which is a little bit of a jargon word, but the idea is that there would be a whole range of activities, face-to-face activities or e-learning activities that students can undertake. And in due course, when we've got a bigger range of activities available, we would ask students to undertake a particular number and range of activities from the ones available. And the particular range of activities that a student does won't necessarily be identical for all students. So a physiotherapy student might do one range of activities, a pharmacy student might do another. But equally, two pharmacy students might do different ranges of activities. It could depend partly on where they're based for their placement. It could depend on their interest. And it will also depend on availability of activities. But the idea is that the students would follow this common strand of theory, and then they would undertake a group of activities from the whole menu. And together, completing the theory and the activities would form their passport, if you like, their passport for progression. At the moment, on the right-hand side, I've just put due diligence for assessment. Assessment is something that we would need to think about in the longer term. Does that make sense, that model, the idea? It has a lot of advantages, this model. It allows us to, we obviously have a number of partner teaching trusts where activities go on, but those activities can't necessarily be replicated everywhere to provide the same experience for all students. And so it allows having a menu of activities that students can select from with guidance, allows for variety of opportunity in different placement trusts, and also for interest of different students. So that's really a series of empty boxes. And what you've got on your page is just an example of what might fill those boxes in the longer term. So, second column in from the left is things that might be in the theory strand. And then in the middle, we've got some example activities that might be in there. And I've highlighted the ones in red that I think could fit well with e-learning or have an e-learning component. And you can see, that there's quite a lot. Certainly, I think for the theory and the common theory, I think there's a big role to play. I think e-learning has a big role to play in that. And then a lot of the activities may well involve e-learning as well. Are there any questions, or is that quite straightforward? There are other, in thinking about how we might build up that model and actually develop it so that we can put it into practice, there are other things that we can look at externally as well. And this, I've just got a couple of examples here. This is something called values exchange, and it's used in a number of universities. This is a slide from the University of Nottingham, which uses the values exchange with their first and second year health profession students. The idea of values exchange is that there are various cases put up on the site. You can see there's one in the middle at the top, which is around about the sort of ethics of using Facebook and so on. But there are various sort of issues that are cases that are posted on there, and then the students are encouraged to discuss particular aspects of those cases with each other, and to share their thoughts about how those issues should be handled, to share their values, etc. And I think this is one that we may wish to investigate further. I think it has a lot of potential, but there are external resources that we can look at. And then that's a student resource, but as we develop the strategy, we'll need to think about tutors and faculty development for tutors. And there are e-learning resources available that we could possibly make use of as well. This is one. It's an excellent site, the Centre for Health Science into Professional Education, Research and Practice, which is quite a handle. But it's from the University of Washington, and it has lots and lots of resources for tutors on how to undertake interprofessional education, how to develop simulation, and these are courses that online courses that you can follow through, and they take about half an hour to do each particular segment. So that's really, I hope that's put some of the issues into some sort of context. As I say, I'm very keen that the steering group is going to be working to develop this strategy over the next few months. E-learning will be central to that strategy, and I'm very keen to have your thoughts and suggestions about how we might take things forward, or just your thoughts on what we've done so far. I've put some possible questions up there that you might like to think about.